So the Apple a Day grant, I first heard about it after I had been a volunteer for the disaster unit for just a short time, and they were talking about doing a basic EMT class, something I never thought I'd be interested in, but once you get into EMS, you want to help people more and more and more. So I was very interested in doing it, and I was excited about it, but didn't have the financial means to do it. I heard from our EMS support that we had this opportunity to apply for this grant, which would cover books and some extra costs for the class, and I was actually able to take the class and get my EMT basic because of the Apple a Day grant.
My husband and I both are registered with the National Registry, and so that requires us to have 72 hours of continuing education every 2 years. And that really is a lot, even when you're retired. And so, and basically here within Lakeview, we've got our monthly meetings, but other than that, it's pretty difficult to find those hours, those accredited hours.
I know that we've gotten some grants and we've put it to good use because it really helps with our training. Training is very big here because we have quite a bit of turnover. Plus, if we can get the training in-house, it saves a lot of drive time and travel time and cost.
It is by far 100% needed, wanted, has to have that availability of those funds. Other rural communities, I would guess, are exactly the same as we are. We can't further our education. For a while, we didn't have hardly any basics. We had no intermediates. And the hospital staff that we did have, obviously, they're on call at the hospital. They're physicians, they're nurses, whatever. They have other priorities. So without that grant, we wouldn't have been able to get the basics through that we did and be able to further our education to be able to offer a better line of service to our clients and customers that need us.
Anything that the state or anybody can help us with the cost really helps us to continue to get our education.
But there's people on this unit, I think, that could very well use a grant like that at least once a year. You know, if the unit doesn't have the money or they want to go to a special conference and they don't have the money to do it, that Apple a Day grant is huge.
Well, anytime that we can get a help with our budget, it makes a big difference, and either we got to give up something else to get the training, or if we can get the training, maybe we can buy some extra equipment.
I believe that everyone in our unit, and I know we're not alone, needs the additional funds to help us get our continuing education credits.
Volunteers are what hold it together. Without volunteers, we wouldn't have EMS in this community. We wouldn't be able to help our community, everyone that needs the help. There would be nobody to respond. So we are solely 100% reliant on our volunteers.